Superior North EMS leadership is sounding the alarm after a record number of code blacks. Wait times for ambulance have been as long as 2 hours, as some paramedics are getting stuck at the hospital for more than 8 hours due to offloading issues at the regional. Staff isolating with COVID-19 has also played a role. All this and call volumes continue to go up. Corey Nordstrom has more.
The frequency of code blacks has grown to an alarming rate locally, more often than it ever has. In simple terms, the code is used when no ambulances are available to respond. Superior North EMS's Andrew Dillon says the situation is growing more dire by the day, with COVID-19 causing staffing shortages and an increase in call volume partially brought on by the opioid crisis, but the biggest impact is delays in offloading patients at the regional hospital.
Our offload delays are both increasing in time and in frequency. We generally are averaging somewhere in that hour and a half, give or take, for an offload delay, but we've seen them as high as 6 or 8 hours. 8 hours of an offload delay is 3/4 of our regular shift. Somebody's sitting with a given patient at the hospital, which means they can't be out responding to other 911 calls.
In efforts to address those lengthy offload delays, Superior North EMS is working with Thunder Bay's Regional Hospital on implementing a program called Fit to Sit. It's currently being done in Sudbury, and Dillon believes it could be only just a matter of weeks before it's put in place locally.
What that does is allow paramedics to triage and bring in lower acuity patients that aren't life-threatening, if you will, that have the ability to wait to see a doctor. It frees up our ambulances to get back out and respond to more emergency calls, and allows the physicians and nurses at the hospital to see the most appropriate higher acuity patients in their priority sequence.
Dillon knows that unfortunately the stresses on his workforce brought on by high rates of opioid use locally is not going away, and he expects it could still be a short while before their staffing levels can return to normal after COVID-19 loosens its grip on paramedics.
Looking at our numbers, we're at least a couple of weeks away from hopefully being out of the COVID concerns for our staff. At least a couple, 3 weeks, I would say.
Dillon stresses that anyone who needs urgent care from EMS will get it. Corey Nordstrom, TBT News.